Hello, everyone. Welcome to the Cities of Service COVID-19 Response Panel, Local Approaches to Food Access. Before we begin the panel, I'd like to highlight some technical information specific to the GoToWebinar platform. You should all see something like this on your screen. To the left is the GoToWebinar viewer. The GoToWebinar viewer where you see the presentation, and to the right is the GoToWebinar panel where you're able to raise your hand, ask questions, and select audio mode. You're listening in using your computer's speaker system by default. If you prefer to call in using the telephone, you can do so in the audio pane by clicking telephone, and the dial-in information will be displayed. If you see the orange arrow in the control panel on the right side of your screen, feel free to click the orange arrow and you'll have access to the entire control panel throughout the webinar. You'll have the opportunity throughout our presentation today to submit questions to our panelists. You can do so by typing into the question panel. You may send in your questions at any time during the panel discussion, and we'll collect these and address them during the Q&A at the end of today's presentation. In the handout section of the panel, you can download the packet, which includes bios of our panelists and relevant resources that they've shared. We'll also make this content available post-webinar. During our discussion, we won't be using slides, and you'll see the panelists themselves. If you're having any technical issues, you can send a message through the chat box, and our colleague Jake is here to assist you. Again, welcome, and thank you for joining today's Cities of Service COVID-19 Response Panel, Local Approaches to Food Access. Before we dive into content, we'd like to take a few minutes to provide some helpful background information. First, we'll introduce our host. My name is Talia Ramella, and I'm Senior Program Associate with Cities of Service. I'm also joined by my colleague Nicola, who's moderating our panel today.
Hi, everyone. My name is Nicola, as Talia said, and I'm the Director of Engagement and Programs here at Cities of Service. On behalf of everyone at Cities of Service, thank you very much for making time out of your busy schedules to join us on this virtual webinar. And a really special shout out to the panelists that you see before you. This is a really crazy time for cities and partners who support cities. So again, thank you for making time for this webinar. For those not familiar with Cities of Service, our mission is to help mayors and city leaders tap into the knowledge, creativity, and service of citizens to solve public problems and create vibrant cities. Now, you've just heard me use the word citizen. For us, the word citizen is not a legal term. Instead, what we mean by that word is to describe residents who participate in their community and who see themselves as integral parts of their city. So to respond to the current health crisis, Cities of Service has worked with our funding partners to provide our grantees flexibility as they apply impact volunteering and engagement to the immediate and long-term needs of vulnerable populations. We are also continuing to keep a pulse on the needs of the greater coalition so that we can curate better webinars like this one, as well as make peer-to-peer connections. So today's virtual panel topic is being felt in every city and community across the country and honestly the world. According to Brookings, by end of April, here in the United States, more than 1 in 5 households and 2 in 5 households with mothers with children 12 and under are going to be and are food insecure. 34% of households with a child 18 and under were food insecure as of late April 2020. A survey that was done between March 25 and April 10 found that 21.9% of households with non-elderly adults were food insecure. This reality has resulted in an increase in food bank demands, and I'm sure you've seen this in your own communities. For example, in South Jersey, they saw a 200% increase in service demand. They saw a mix of low-income families, but also newly unemployed residents using the services for the very first time. As a result, the report of food bank closures have surfaced as well. in addition to shortage of staples like cereal, dry milk, and flour. Here in New York City, the Food Bank of New York City, for example, reported 309 closures within its network of soup kitchens and food pantries as of mid-April. That's around 40% of its network, up from 118 closures roughly a month ago. As you can see, and as you all know, this is a complex situation. The cities have to find creative ways to meet immediate food needs for students, the newly unemployed households, housebound residents like some seniors, for example, and residents with dietary restrictions. Cities have to convert community centers into grab and go or food distribution sites, pay attention to supply chains, enroll eligible residents into SNAP, monitor safety of volunteers as well as the food, all of this while fundraising and planning long-term recovery. And not to mention supporting frontline service providers that are doing this work. So once again, thank you for being here and being part of this discussion. We're glad to see everyone. Over 100 people are on the webinar, over 450 have registered. So Talia, over to you to cover the agenda.
Thanks, Nicola. Here's our agenda for the panel today. We'll spend the first hour or so in our panel discussion. And again, you may type questions at any time into the question pane and we'll collect them. Then we'll take 20 to 30 minutes at the end for our Q&A with the panelists, and we invite you as the participants to also share your ideas, experiences, and thoughts. And then we'll wrap up at the end. Our hope for you today is to gain ideas and examples of ways cities across the country are working to meet food access needs of their most vulnerable groups. Back to you, Nicola.
Thanks, Talia. So today we have 4 panelists representing city government and civic engagement leaders that are committed to supporting cities. And we'd like to give a quick introduction of them right now. As Talia mentioned, please download the handout. You'll see their full bio and the resources they've shared with everyone. So first we have Ona Balkus. She's the Food Policy Director at District of Columbia. Hi, Ona. Ben Cares. He's a city planner and project manager at City of Chelsea, Massachusetts. Hi, Ben. We have Andi Crawford. She's the Chief Innovation Officer and Director of Neighborhoods and Citizen Engagement at the City of Lansing, Michigan. Hi, Andi. And then we have Patrick Hain. He's the Financial Empowerment Program Manager at the National League of Cities. Hi, Patrick. This is a tremendous group of people that are doing some tremendous work in cities and also supporting cities with their response to food access. So without further ado, we're going to start the virtual panel section of this webinar. So some background information for our participants. We offered our panelists a list of questions to respond to prior to this virtual panel. We'll be using their answers to help curate the panel. We are not going to be able to cover and explore all the nuances of food access today, but we do hope that we'll hit on some key elements and that this virtual panel will be a catalyst for you all to connect with each other around this topic. Attendees, please ask your questions throughout. As Talia mentioned, she will be organizing your questions on an ongoing basis, and we'll get to them at 1 p.m. Eastern Standard Time during our question and answer portion. And more on that a little later. In terms of the flow of the panel discussion, here are the questions that we're going to explore today. We're going to start with problem scoping, meaning what data are cities using to understand who's impacted and how, and what role did engagement play in this stage for cities. Next, we're going to talk about processes and policies and partnerships that cities have enhanced to ensure food access. And we also want to hear what kind of volunteer roles cities have been leveraging during this stage. Next, we'll talk about how cities are coordinating services when they discover residents with needs that go beyond food access. So for example, somebody who doesn't have access to food but also needs help with childcare, just throw an example out there. Next is how are cities integrating food access into COVID-19 recovery planning, both midterm and long-term. And then lastly, what challenges did cities face around food access and how did they try to manage these challenges? Panelists, as a reminder, keep your answers to 5 minutes or below, and please share new information if you're answering the same question that was covered by a previous panelist. As a reminder, we'll mute and unmute folks just to help with background noise. So let's go ahead and get started. As I mentioned, our first question is all about tools and data that cities use to understand the breadth and depth of food access needs of key impacted groups in their cities. And I would love to start with Ben, who, as a reminder, is a city planner at the city of Chelsea, Massachusetts. Ben, you and your colleagues did something really interesting. You used existing tools to collect the data and did quick engagement to also capture input from community members. Could you talk to us a little bit about your city's approach to understanding who was impacted and how when it comes to food access?
Definitely. So I think that first and foremost, in terms of food security, it's kind of a black box when you aren't directly engaging with residents, and especially when people are quarantined or isolated to their homes. So the first thing that we targeted was actually our 311 call center, which is normally how residents would notify the Department of Public Works of things that need to be taken care of. So we basically retrofitted that as sort of a intake, what would you call it, like a call center, I guess, and ran 8-hour shifts Monday through Sunday and developed these intake forms on this app called Airtable, if anybody's familiar with that. It's basically just a way of creating like glorified spreadsheets and intake forms. It allows you to collect data pretty rapidly because not only can the 311 operators fill them out, but you can send the links to other individuals. And so through the 311 operator system and also through engagement with city councilors, with special attention given to socioeconomic demographics of districts, we were sort of able to begin our approach and how we're going to address the food insecurities. So basically that live data coupled with what we already knew about our community allowed us to sort of start promoting outreach and notifying residents that we were going to be starting to do a food program.
Thank you. I'd like to turn it over to other panelists on the screens here. If you have an interesting example of how your city used existing data or engaged community members to understand the scope and the breadth of the problem here.
I can chime in. We also are deploying a 311 hotline, and not to skip ahead, but to your next question about coordinating with other services, the hotline is both it's like a comprehensive needs assessment. So there are questions about food security, but also connecting people with unemployment resources and other public benefits, and also if they need hygiene materials like diapers or toilet paper and other essentials for really anyone who's home and don't have the resources to stay home. And then I also wanted to mention right at the beginning of the crisis, I got this idea from San Francisco and I loved it, and we rolled with it, which we started having regular calls with all of the emergency food providers. And we were having them every day. Then we went down to twice a week, which seems to be our sweet spot. And they've been really valuable both for us as government officials to understand the gaps that the really on the ground service providers are seeing in terms of what populations are in need. But also on every call, everyone reports on how many people they're serving with their programs. So it's been a regular way to see the uptick in need over the last 2 months. So that's been a valuable way to collect data as well.
Thank you both. I want to jump into kind of similar to the process as you all are putting in place, but let's jump into the next question, which is about process and policies and partnerships that have been enhanced or created to ensure food access for COVID-19. And Ona, if you wouldn't mind kind of continuing this conversation, because you and your colleagues have done some really interesting work as well, from streamlining an application to sustaining a creative partnership and even using the Metro bus lines for meal sites. So could you share with us a little bit how your city is enhancing processes and policies and leveraging the particular partnership with Central Kitchen to ensure food access?
Yeah, happy to. So we in DC, I'm sure, as with many cities, have really strong nonprofit partners, which have really been amazing assets during the crisis. And we did enter into contracts with DC Central Kitchen, which is a local nonprofit that employs returning citizens to provide to create meals and also grocery boxes. And in addition to them, we've partnered with Martha's Table, another wonderful DC nonprofit, to create grocery boxes that we distribute at 10 school sites around the city. And those sites are also 10 of the around 50 sites where DC is distributing grab and go meals for all of our students. So we're distributing 300 boxes at each site. So about 3,000 boxes a week with our partnership with DC Central Kitchen and Martha's Table. And we're also proud that the vast majority of the food in those grocery boxes is fresh produce, which there has been a huge need for and request for from the residents who are visiting those sites. And then in addition to those contracts, we've contracted with a local grocery store and regional food hub who are making resiliency boxes, which is 10 to 14 days worth of groceries for people who have been instructed to quarantine by a healthcare provider. And with that contract too, we're really proud of that partnership, both because the local grocery store, it's locally owned, it's employing a lot of district residents. So we really wanted to be able to support them. And then the regional food hub similarly is employing a lot of residents, but also sourcing fresh, locally sourced produce from the region and supporting small farmers. I could go on about partnerships. I mean, we have an incredible amount of nonprofits doing work here in DC that we're trying to support. We're also exploring the FEMA process of getting any nonprofit who's providing emergency food assistance reimbursed 75% of their costs, which I'm sure many cities are exploring around the country. I guess one more thing I'll mention is DC Hunger Solutions is more of a policy-focused nonprofit, and they have been real, and they're like our local FRAC affiliate, which I think a lot of cities have. And they have been really helpful in the outreach piece that you mentioned. So they've hosted webinars for anybody who is a resident with a child. Here are all of the resources, food and beyond. They actually have one of those tomorrow. They have a hotline for helping people navigate the new online applications for WIC and SNAP, which we just started doing during the crisis. So nonprofits have also been really valuable in helping residents navigate the new expanded list of resources that are out there.
That's really amazing that you and your colleagues are aware of who these partners are and have the relationships to connect with them in a way that they can do the best work that they've been doing for many, many years, many, many months, even before this crisis. Can you just give us a little behind the scenes of what these partnerships, when you say we develop these partnerships, what does that mean? Was it financial support, and then if it was, where does that financial support come from? Or however you want to frame it.
Sure. Yes, I do want to answer that question. And I also want to answer a question you didn't ask, which is how did we develop these relationships with nonprofits? And I really want to underscore that my job exists in the District of Columbia, that there is a food policy director that works for the mayor. I run the DC Food Policy Council, which is 13 mayoral appointed experts in the food system. And so many of the organizations I just mentioned, they have representatives on the Food Policy Council, and we are a very close group that have been meeting for years, coming up with priorities for the district's food system for years. So when this hit, it wasn't, a matter of reaching out, doing cold calls. These were very close colleagues that I have been talking to for a long time about what the district needs to be doing around food insecurity and food access and where we could be stronger. So I just want to underscore that having that structure in place has been really, really valuable. And I know for other cities that have it, it has been too. So any cities that are looking at recovery and what food access looks like after COVID, I would really encourage thinking about having food policy staff on the city. Your question about partnerships, sometimes it's been financial. So with Martha's Table, DC Central Kitchen, Good Food Markets, which is the local grocer, those are all contracts that we entered with emergency funds from the city that we hope to get reimbursed by FEMA, because it's very closely tied to emergency food provisions during the crisis. With DC Hunger Solutions, it's been more of resource sharing in both directions. So it kind of depends, nonprofit by nonprofit, what the needs are and where the city can be most helpful.
Perfect. One other thing that I thought was really interesting, and I've seen a few other cities do this as well, you all combined a number of applications into one. Can you talk a little bit about that?
I can. I'm not the expert on it, but I'm happy to tell you all what I know and connect anybody who needs more information to the right people on our team. But the city for years has been going through a process where we've been trying to streamline our public benefit applications. I will say we are in a unique position because we're not quite a city and we're not quite a state. Hopefully we will be at some point, but we act like a state in that we administer all of our federal public benefit programs. So there's not like a state agency we have to go to. It's the district's agencies that administer SNAP and WIC and TANF. So for years now, we've been working on streamlining a process of making it so that you only have to apply once for a host of federal benefits, and that's obviously been really valuable during this time because we have a lot of residents who never needed public benefits before that are now applying for the first time. So being able to make that as simple a process as possible. And as I mentioned, also we've moved a lot online and over the phone. So with the WIC program, that's for women, infants, and children. You can now apply for that over the phone and get your checks in the mail rather than having to go in person. And for our SNAP program, that whole application has moved online. And we also are very excited to share that USDA is now letting us allow SNAP customers to purchase their groceries online and get it delivered, which I know a few other states have been added to that program as well, California, Florida, and maybe a handful of others. So that's just a game changer for our city.
Thank you. Andi, I want to jump over to you. Andi's with the city of Lansing. Your city has established both food pantries and mobile sites. We'd love to hear about that a little bit. And also, you mentioned that one is getting a lot more usage, like the mobile sites are over the others, and there's kind of a tension there. So what is the city observing? What is the city thinking moving forward around that tension?
Well, primarily the city either funds or facilitates some of these options. There's very little that we do direct service for in the food space. We do operate a mobile food pantry, which is a once monthly very large scale food distribution, and that's been going on since our last major crisis. We're about a decade away from our past real significant hit to our economy. So we've pulled a lot of things off the shelf and dusted them off from that time as we move through this, in addition to health challenge, real financial challenge. So we do have an existing mobile food pantry that's been in place, but it had to change in its service delivery, and it has become much more of a drive-through curbside, like many other places are doing. And that change wouldn't have taken place without this happening. So there's probably some user experience enhancements that were hastened by the situation we're in now. What we're seeing, though, is food is one of a basket full of basic needs that we have as humans, and what we're seeing is that food actually has been something that we're seeing a lot of financial resources and support for. Our food pantries and our food bank has really been the recipient of a lot of generosity. And so we're trying to work in our partnerships to make sure that other things are also supported. So we've had, in fact, our food bank say, as we raise money for household needs, let's shift a little bit away from food because we're really quite flush at this point, and make sure we get things in for mortgage and rent assistance, childcare, basic needs, utility assistance, etc. So that basket of basic needs is being rebalanced a little bit. You mentioned our brick and mortar food pantries, and it has been really interesting that our curbside pickup, and the bulk of which in the city of Lansing is being done by our school district, who already bears an overwhelming disproportionate burden for social services, and was very quick to go right into food distribution, and is doing an extraordinary amount of food distribution across the city. And that is operated outside of the city, but as a different entity, the school district. So we don't run our schools, but we certainly are, hand in glove in terms of our partnership. So they're carrying really the burden of that, and they're seeing a tremendous utilization, and they aren't making a distinction between whether or not your child goes to school at their location or not. They're serving without an enrollment requirement. So they're seeing this huge uptick. But what we're hearing from our food network is that our pantries are really not being utilized. And they have more capacity than is being taken advantage of. Meanwhile, our kind of curbside drive-through are being really strained. I think that if I were to make some assumptions about that, there's probably some user experience things that we could glean from that. And I'd love to take some more time to analyze it while trying to run it, right? Not myself, but the system is running it. But I think there's certainly something around safety, having it put right into your car. There's I think certainly something around convenience without question, but there may be a question around dignity and around some kind of anonymity of usage. And that's just something that we're exploring, that there may be a difference there on how people are utilizing, and that might be a way for us to rethink about the system as we continue to expand it or continue to move out of response and into rebuilding and recovery.
Thank you, Andi. Ben, I just want to kind of give you an opportunity to kind of shed light on this. Oona mentioned that thanks to her role, it's not like she had to cold call different nonprofits and groups to start building these partnerships to respond to the crisis. And I know you and your team had put together this intake strategy that you mentioned, and that you connected some community stakeholders to that to help you. Can you talk a little bit about how did you build those partnerships? Were they there already? Like, how did this all work?
Definitely. I mean, I think the most important thing to note here is that the city of Chelsea, we have an extension of one of our hospitals that grapples with hunger, the Hunger Network, but we don't have any food policy staff in the city. And so our department, planning and development, 3 out of the 6 members of the pandemic response team, that's planning and development. So we had to sort of shift very quickly over to understanding how food systems work, understanding how we're going to, get the deliveries out, how we're actually going to do, pop-up pantries, what is the existing infrastructure looking like. But in terms of stakeholder engagement, we already had those relationships. There's actually 2 primary ones in Chelsea that are extremely representative of the demographics of, why we're a sanctuary city, which is, language barriers or language needs and minority status. So that's Green Roots. They're an environmental justice population nonprofit. And then the Chelsea Collaborative, who really has their finger on the pulse with most of the Hispanic and Latinx demographics here. So we basically knew who to call. Luckily, Chelsea is 1.8 square miles, so everybody sort of knows each other. So it wasn't too heavy of a lift, I guess, to create this framework. We kind of went through several iterations of really big meetings with people and then broke it down into different focus groups for the pandemic response team. So it ended up being sort of like medical kits and then food security and then housing. And there's certainly cross-fertilization between all of those. But at the heart of it, the pandemic response team and the Airtable platform, and these like daily calls, and then like, maybe 3 times a week calls. Those really dictated the sort of sequencing of the meetings. And in that manner, we were able to just engage effectively with stakeholder members, get what we needed, whether that was financial contributions, whether it was data, whether it was just sort of, a logistical connection. And then as we did that iterative process through meetings, we sort of got our outcome, which was our pretty robust food network. We operate our food network out of a retrofitted park space down near the water in Chelsea. And we do about 1,000 boxes of food a day. And we do about 200 families a day for delivery, which is sizable considering the population of Chelsea. So that was in the span of about 3 weeks. So I think we did a pretty fantastic job. And like I said, the stakeholder engagement was easy because we already had those relationships just within the context of what we do as a planning department.
Thank you. Patrick, I want to turn it over to you. And for those of you who don't know, Patrick is with National League of Cities. Patrick, you and your colleagues have been noticing cities using their purchasing power to hire local restaurants to prepare meals for vulnerable populations. You've also seen how city funds are being blended with private funds to support anti-hunger nonprofit service providers. Could you highlight a few city examples for both of these observations for us?
Yeah, certainly. I'm very excited to be here with such esteemed panelists. I will say that right now. So on the city commingling of funds side, this is one of the things that we saw really start happening quickly, as whether it was private philanthropy or businesses really trying to think about what they could do for their communities. It was really stepping up and thinking about and engaging local leaders around who is, as Ben was saying, that food ecosystem. Like, who are those folks if they didn't know them already? Local government is a trusted source to direct some of those resources and has those partnerships. So Louisville, Kentucky, and Denver are two, I think, really big examples. In Denver in particular, the city partnered with their health foundation and their local community foundation to fund $1.1 million for local hunger organizations. They actually received an additional $500,000, so they pumped 1.6 total already through this system to meet some of the needs. Another thing I would say is some of this is because the cities are also looking at all of their funding sources. So I would say, from a starting point, not only understanding your ecosystem, but what's on the menu, what's the opportunity there to bring resources to bear, right? So in another way, even though this was just direct city funding, Seattle's a perfect example. They leveraged their tax authority to really repurpose funds that were going for the purposes of helping low-income families, and they repurposed those fundings for $800 a month for grocery store purchases, which is a large amount. It was what made sense for their community based upon the research that they had. But it was really, really interesting and exciting to see the city step up in that way. On the purchasing power front, this has been a really interesting thing because it fits kind of the two sides of this. The city is trying to be responsive to community resident need, but also thinking about the businesses within their localities. Like Ben, you were saying a little bit, Anna as well, thinking about who within your community that's operating has deep roots, if you will, and how do you, through your contracting opportunities, really support that. So Ben, down the road in Cambridge, Massachusetts is one example that I would point to. They have been really partnering through contracts and buying meals from the local restaurants to provide meals to shelters because the shelters themselves actually don't have enough staff, or where they are, it just doesn't make logical sense from a health and safety perspective.
Yeah, thank you for that. It really helps us see how different cities are responding to the needs of the most vulnerable groups. And, vulnerable groups have been here before COVID-19 as well. And we've all seen that their needs have been increased as a result of this virus. So it's really cool to see that each of your cities is keeping a pulse on that and trying to figure out the best ways to meet needs of multiple stakeholders, even those who maybe traditionally have maybe been left out in the margins by no fault of anyone. And so one thing that I would love to explore a little more is the role of volunteering. Ben, I'm going to jump to you. You have this really interesting example, which is you have in-person volunteering opportunities, but you also have some remote ones. So can you highlight a little bit about the in-person ones, but also tell us about the remote positions as well?
Sure. I guess we have volunteer opportunities that we've distilled through like Airtable. Like we had a forum for volunteers and they would tag like, I'm bilingual, I'm interested in food, I'm interested in whatever. So basically I mined that volunteer base for some remote and in-person volunteers. And the reasoning is that after 311 did the intake system, and Anna was talking about this, like that's a triage system. So it's like for housing, it's for food, it's for domestic abuse, it's for any of those things related to being isolated at home or impacted by this pandemic. So after 311, that sort of primary system, we went down to a secondary dispatch, which was remote volunteers, a lot of them bilingual, and they were able to take the families or the people that had been inputted in that needed food and basically call out to them to verify their address and to verify their family size, but also to delegate to the in-person volunteers. And this all happened within Airtable, and I set up this base to be able to do this. And basically these dispatchers had a shift where they delegated out, depending on the following day, which food delivery person was going to do that task. And so basically the remote volunteers delegated, and then the in-person volunteers, by the time they showed up, they had the app on their phone, they knew exactly who they were delivering to, and they also had the person that tagged them in it, just in case they needed to interface. And on this app, they have the picture that they can take of the food that's dropped off, the phone number of the family size, everything is there. So it's like primary, secondary, tertiary, like remote, in-person. And that was extremely effective. And we were able to do, I have about 35 to 40 personal drivers underneath me that do deliveries every day, in addition to some other companies that we've contracted with to do like larger scale recurring deliveries of food. So I think that it's interesting to see how the pandemic has like forced people into these remote positions, and even volunteers, not just people that are actually, this is their job, to do those types of tasks.
Yeah. Patrick, I think you and your team also noticed some interesting ways that volunteers were used to meet even some service needs, for example.
Yeah. So one of the ways that the National League of Cities were keeping up with all the towns, cities, and villages of what they're doing on multiple fronts as it relates to COVID is we have a local action tracker that we've encouraged all either city staff or elected to let us know. So one of the things that we've actually seen pop up more and more is really thinking about, Ben, what you're saying sounds phenomenal, and it's very techie and amazing. I wish I had more of you throughout many cities, sir. More of the cities that we see, including like a clustering of medium-sized cities or smaller cities in California, is really thinking about kind of old school kind of hotlines, using 311 or 211 with local United Way assistance, and really thinking about getting food, medicine, and also just being there if people need to talk. That's something that's hugely important in all of these times, as even as we shift to being open more and more. It's a huge void for a lot of folks who don't necessarily have as many connections or contacts, and particularly for those that have less access to the internet. I'm personally blessed. Our apartment has the internet, right? For many Americans across the country, that's not the case. So having those kinds of phone conversations at the very least is extremely helpful. So Burbank, California is doing a lot of this, but they're really focused on seniors in their community, right? Making sure that they first and foremost have those needs met. We're seeing more expansion of these types of services as cities bring in more, if I would, trusted partners for specific populations that maybe necessarily they haven't had really great connections with or strong connections with in the past. And some of this as well is just because of the evolving nature of trust of government. You'll see from polling and things like that, the local government is just trusted more. Same with states right now. And I think that's playing out as well when we talk about meeting the acute needs of whether it's returning citizens, whether it's immigrants, whether it's those that just don't have English as their native language. Localities are filling that void with trusted partners.
Yeah. I want to jump into the next question, which is around recovery planning, and how are your cities and the cities you work with in your case, Patrick, how are they including food access within the recovery plan, both midterm and moving forward? And I'd like to kick it off with Andi from Lansing. Andi, we know that agriculture is not something, urban agriculture is not something new to your city. So could you share with us how the city and partners are responding to residents' desires to have more localized food systems? What have been some conversations, ideas, or actions around food access within the city's COVID-19 recovery planning?
Yeah, we have a rich history of urban ag, and certainly our region is home to, the greatest university in the world, Michigan State University, and of course has we have tremendous technical support for agriculture of all sizes, and certainly great resources for urban ag. And of course, all of their graduate students live in our neighborhoods and, are doing great things around farming. So we're just very blessed with a resource around the technical aspects of small to very large agriculture. So we've got a lot to draw upon there. What we're really seeing here, in particular, your note about moving from, acute response into recovery, is a real understanding, not just in the food space, but in every space, about the value of a local supply chain and how critical it is to support your local economy and to have local resilience. And so we are seeing that, while there's always been an interest in urban ag, for some folks, there will never be an interest in growing your own food. I remember at one point in my career when we were doing a lot of community engagement around, community gardening, which are lovely projects, but one woman told me, just because I'm poor doesn't mean I want to grow my own food. Do you grow your own food? And no, I don't grow my own food. I go to the store and buy food. So it's not a single solution just to say we're going to teach people how to grow food or give them access to that. It also doesn't solve a year-round problem in our climate. So the question really is there a way to really look at local food and support local food that doesn't necessarily turn everyone into cultivating their own food? And of course there is. There's our robust system of farmers markets, and a trend that we're certainly seeing here, and I've heard it is taking place across the country and the world, is CSAs are really being seen as a really great opportunity for community-supported agriculture, CSAs, and subscription boxes and those types of things where people are buying into shares of their local food supply. And in conversations here locally, one of our only year-round farmers market at Allen Neighborhood Center, who has built an entire organization around food and as a community development tool, has really seen their subscriptions for their CSAs fill up very quickly and be very popular as people are understanding that the fewer hands literally that touch your food, the fewer opportunities there are for transmission of any kind of disease. I know last year they were marketing their like E. coli free romaine lettuce, and they're witty over there at Allen Neighborhood Center, but it's thinking about shortening the supply chain and keeping it hyper local and building an economy around that is something that we're thinking about a lot here. And I think people are understanding the value of that from a nutritional perspective, from an economic perspective, from a food safety perspective. So it's a rich discussion to think about how, as unfortunate as this situation is, how it may return us back to thinking about local supply chains in all aspects of, particularly of our critical needs.
Ona, I'd love to hear from you as someone who lives, breathes, sings, dances, everything food. Where is DC in this kind of recovery planning conversation in terms of food access?
Sure. So we're in the midst of developing our Reopen DC plan, which you can learn more at coronavirus.dc.gov/reopen. But the plan it's a pretty massive undertaking. The mayor, along with her two Reopen chairs, has 11 committees working on thinking about how we would reopen different parts of the district's economy, public space, public life. One of those committees is restaurants and food, which I serve on. So our recommendations will span everything from how do we start to reopen restaurants and food retail businesses while ensuring that both workers and customers are safe and have proper protection, to things like how do we, right now our farmers markets have to get a waiver to operate during the public health emergency. So how do we transition to relaxing that waiver and moving back towards normal operations while also keeping everyone safe. But also the Mayor Bowser has talked a lot about how do we, as Andi was mentioning, take this awful circumstance as an opportunity to also think about how do we reopen stronger, how do we reopen in a way that gets us towards our goals around equity, addresses the health inequities that this crisis has really brought to light. And I think food plays a key role in all of that. We knew that parts of our city had insufficient access to healthy food and high rates of diet-related chronic disease. And now those are the parts of the city that are being hit hardest by COVID-19. So how do we take that into account as we're recovering, make sure there's adequate and sufficient food access, make sure that we're creating wealth generating opportunities for our district residents. As Andi rightly said, we don't want to just give people free food. We want them to not need free food anymore. How do we use our food policies to make sure that people are making living wages, owning their own businesses, and creating pathways to the middle class? So our reopen plan, at least the draft, we'll see what makes it into the final, but certainly covers all of that. And that will also be really important for our recovery work. We will be doing food security forecasting, so looking at our new rates of food insecurity in the district, what we think that might look like 6 months from now, 12 months from now, 18 months from now, because we know we can't go back to normal in terms of what normal meant for food assistance before this, where our numbers are just going to be very, very different, and we're going to need a different type of response. And it probably doesn't make sense for the district to continue operating emergency food responses forever. So how do we support all of our partners in making sure they have the capacity to address those new rates?
Yeah. Well, we definitely plan to do future webinars where we talk about, now we're in recovery, how are we engaging folks, what are we doing? So we'll be keeping tabs on Ona and Andi for sure. Patrick or Ben, any kind of conversations you all have seen at your cities around how do we recover and put a recovery plan together with food access in mind?
Ben, you okay if I go first?
Oh, you go first, yeah.
Okay, cool. So across the country, this is something regrettably not everyone has a food policy council or a food policy person on their staff. So there's a lot of nonprofits that in some ways fill those voids, right? Moving forward, though, because of all of this, and in some ways as well, the highlights that have happened because of the meat processing plants and different limitations and things like that now everyone is experiencing, these kind of unevenness regarding their own food that they select, right, or want. is propping all of this back up. I would say the only thing I would add to what the other folks said was that from a long-term planning perspective, we're hearing a little bit more around vertical farming, and folks starting to get a little bit more interested in that. And, good old hydroponic farming is starting to make another interesting comeback in some areas. These are particular methods that folks have been thinking about in the resilience space, right? Because of climate change and things like that. Because before, I think it makes a lot of sense that these are things that folks locally should be thinking about as they're thinking about long-term sustainability dollars, where they're going to invest now with any more federal funds that might come through. It just creates a larger opportunity to create the future that we want because, as others have said, it wasn't working well before. We were not filling all of the needs within our communities. And so with all of this, it's what is the future we want to have and how can we make it happen? So with that, Ben, it's yours.
Yeah, just to reiterate, the city of Chelsea wasn't doing a fantastic job with addressing need. Just to sort of echo what Patrick, what you're saying. And I think that as a country, we don't necessarily do that. And there's not as much sort of federal help that there could be. We do receive CDBG funds. There's a possibility to reallocate some of those towards either building staff infrastructure or building site infrastructure, but those are all tied with, red tape and whatnot. So we sort of have broken our strategy into a couple of different things. We are tapering down our acute response, which was the food deliveries and the sort of retrofit of this park space to create boxes of food, coordinate with the National Guard to get those out to people in person, but also do the home deliveries. The medium-term solution would be for the rest of the summer to continue this sort of city-run pantry at some capacity, but less so, maybe 3 times a week. Still do the deliveries, but sort of taper away, do a better, more discerning job of triaging who actually needs it delivered versus who can come out and get it. And then as we're sort of doing that medium-term thing, maybe ramping down, maybe anticipating a second wave, coordinating with stakeholder groups, with the Hunger Network, with the Chelsea Collaborative and Green Roots, like I mentioned, and just really having a frank conversation about how are we going to address hunger post-pandemic? How are we doing it pre-pandemic? Where were the gaps there? And we've only just amplified that now. So people talk about a way forward after COVID-19. And I think that this is highlighting a gap. It's highlighting something that needed to be addressed. And now we're being forced to do so. So we're looking forward to coming up with a really robust long-term solution. But it seems like there's some people on this video that I should potentially talk to after and get some ideas from.
So we have 7 minutes left, so I think we could maybe give you the space to talk a little bit about some challenges you faced around responding and planning around COVID-19 in terms of food access. And maybe share 1 or 2 really key challenges and how you are managing it or how you overcame it. And anybody can start with this question.
I'm sorry, did you say Andy?
Sure, go for it.
Okay, I didn't know what you said. I was being unmuted and muted multiple times there, so it was a little disorienting. I'll very quickly. I know that this is Cities of Service, so it's all about mobilizing our citizens in the community, and very difficult to mobilize during this type of crisis. So we spent a lot of time, what seems like 2 years ago, but I guess it's about 8 weeks ago, in the very rapid response. We spent a lot of time trying to understand how do we put the overwhelming response. We had a lot of people that wanted to help, and you want to give them an avenue to help, and you got to do that. It was very early on in what we knew about what was happening, and we were trying to make sure that we were doing that safely and not quelching great will of our community, but channeling it into activities that were going to be healthy for our community. And we had to pull together with our food bank experts a really big group of, especially our faith community, and especially our faith community in our most vulnerable populations, and ask them to discontinue some of the food service that they were doing, because it was bringing in together a whole bunch of vulnerable people who were their typical volunteer pool, and then potentially transmitting a whole bunch of potential contaminants amongst this food distribution. And so really trying to educate, and this is where I think the city has one of our highest and best purposes, is that we can convene the appropriate people. So in my position, I spend much of my time just trying to match make between a technical expert and a community who needs that technical expertise. And so, pulling together our food bank and the folks who do this, and helping them to communicate to a whole lot of folks that they'd wanted to know for a long time but didn't know in our community, and help. And they walked through, here are all of the steps that we take to secure safe food distribution. And we put out technical information that would help and support, and say, if you're not following these guidelines, you should not be doing a food distribution. But here's how we can help relocate that distribution, or partner with you effectively, or put you on one of our deliveries. This is where Tri-County Office on Aging and Meals on Wheels really, shown, which is such a classic program that all of a sudden, when you close down every senior congregate meal site, now everyone is going to be doing food delivery door to door. But really helping to explain how sophisticated of a system you have to ensure security in a food system, and really helping people who wanted to engage volunteers to do it appropriately. It also was an opportunity to talk about how much further a dollar given to the food bank goes than 3 cans of food given to the food bank, and talk about the economics involved of food distribution, bulk purchasing, supply chain, etc. So there's a lot of time that we spent just trying to pump the brakes on very well-meaning, very well-spirited efforts to say, time out before you organize this weekend and pull together 60 of your most vulnerable parishioners, and then hand out food to your other 200 vulnerable. Let's try to think this through and channel that. And then when you are trying to do things like simply solicit monetary donations, how do you make someone get some of that good feeling of volunteering from what could be just a transactional participation as a citizen? So the volunteer side of this is really challenging, and I know it's what Cities of Service thinks about all the time.
Yeah, great point. And definitely there's like many different entry levels for engagement and volunteerism at each of these steps that we've explored during this call so far. I want to respect our time and shift over to the Q&A portion of the virtual panel. So, but before that, I think maybe if there's like one more challenge somebody is really proud that they're managed or overcame, if you want to share before we switch to Q&A.
Sure. Well, I'm ditto to everything Andi said. It was a lot at once, and a lot of people offering to help, and trying to divert that good energy in positive ways and safe ways. I will add to that, our Department of Health created safety guidelines for anyone who was doing emergency assistance, which were really, really helpful, and we distributed those widely to all of our emergency food providers. Yeah, I think the one other thing that we have heard a lot, we are a dense city, and there has been a lot of need for commercial kitchen space and cold storage space for all of this emergency food that needs to be made and distributed very quickly, especially because we were prioritizing fresh produce and are. So luckily, right before the spending freeze happened here in the city, we had just started a contract with a consultant to do a study on best practices for building a centralized kitchen in DC. And before this crisis, we had thought it would be beneficial for like improving school meals and meals for seniors and workforce development and a bunch of other of our goals around our food system. And now it's also going to have a lot of lessons in it about how can we be better prepared next time with infrastructure. Because there was a lot of scrambling to find like unused church basements and school and restaurant kitchens that were closed that somebody could get into to make 1,000 meals. And I would like to have a plan for that next time. So I'm really glad we were able to commission the study right in time, and I'm hoping that'll be useful for next time.
Thank you. Thank you. So with that said, this will conclude the virtual panel portion of the webinar. We'll move into Q&A. So here's how this will work. We're going to select a question from the participants and give the panelists up to 5 minutes to share their perspectives on what they think the answers are to that question. We'll then take 5 minutes for participants to provide answers to the same question as well, if appropriate. Participants, if you do end up wanting to share your answers with us, please share something new that you haven't heard based on others who've shared an answer as well. We will unmute you ourselves. So once again, we know that this topic is complex. So anybody that's answering a question, please just stick to the question that was asked so that we can get to as many questions as possible. So without further ado, let's dive into some of these participant questions. One of the questions that has come up, and this is for DC specifically, how do you handle, where is it here? How do you handle delivery fees for grocery delivery with SNAP?
Oh, how do we, you got a little cut off right in the middle. How are we doing grocery delivery with SNAP?
How do you handle delivery fees for grocery delivery with SNAP?
Okay, I'm glad I clarified. I missed the word fees. So we are just literally starting to roll this out this week, and I don't want to get too in the weeds, and I'm happy to talk offline to folks about it. But so right now, so you have to be a retailer doing SNAP delivery has to be a USDA authorized online SNAP retailer. We only had 2 of those in the city when we got approved, Walmart and Amazon. And Walmart is not going to work out, so we have Amazon. And the way Amazon is handling delivery fees is the customer is basically treated like a Prime customer. So for Amazon Pantry, any order over $25, the delivery fee is waived. And for Amazon Prime, there's like all of those different Amazon stores, whatever. For one of them, it's over 25, for the other, it's 35, your delivery fee is waived. If your purchase is under those amounts, you basically have to like put in separate debit or credit card information to pay the delivery fee portion of the SNAP purchase. We are working really actively to get some of our local retailers online. We would love for them to benefit from this. It's just a process of having the software in place and then applying to USDA. So it's going to take a little bit of time. We're really optimistic we're going to get not only small grocers, but perhaps some of our farmers markets to be able to accept SNAP for delivery. In that case, they would have to either, we've explored like whether we could get them some like philanthropic support to cover the delivery fees, or they would have to go through the same process as Amazon, which is having a separate EBT machine that takes the credit or debit card information just for the delivery, which we are trying to avoid. So exploring different options, but it is challenging for sure.
Thank you. The next question was really popular. Multiple people asked it, and it's, what are your plans to feed people, especially children, during the summer months? Are schools continuing service level or scaling back? And anybody can take this one that has some insights.
I can go.
And
that's okay with everybody.
Go ahead.
So, like I said, our medium-term plan is to continue our food distribution like city pantry. That includes pop-up locations, so 3 times a week to 2 times a week throughout the summer, and then the home delivery system. And so the school program itself, their funding doesn't go all the way through the summer necessarily, but they are thinking and strategizing. They might just piggyback off of our operation just because it's a little bit more efficient and you eliminate some of the redundancies geographically. Like if all the schools are doing it and then we're also doing pop-up locations, like it might just be easier to sort of funnel in all of those resources and staff into running like 3 sites a week. So that's our plan, and we certainly understand that need, and we will be addressing it throughout the remainder of the summer.
Thank you. Any other panelists want to contribute before? Oh, go, Patrick.
Thank you. The other thing I would say, excuse me, before COVID threw all of us off, you know, we had been doing some work with municipalities across the country with our CHAMPS program, which was really connecting youth to summer or after school meals. In our last cohort of cities, which was a small cohort, only 6, they created campaigns. And in the summer months, they were really looking at how to build the infrastructure through leveraging, first and foremost, their food and nutrition services in their school districts. But then also all of the other folks within their community that had capacity or had programming already in place. From what I'm hearing from folks within those cohorts and our other 70 plus that we have worked with before that cohort specifically, a lot of them are really thinking about how are they going to take the lessons learned from Ben's point around grab and go, other things, and doing more hardcore, or what we would loosely call just data analysis. But for them, it's a little bit more really thinking about beyond who would be the normal that you would have to serve or want to serve because they were high stress areas, how that's more communities, right? As you were saying in the beginning, leading up to the start of this, you know, we've pushed folks that were on the margins down, right? And the longer this goes and as the transition slowly ramps up, we're going to have more opportunities. So one thing that I think is something top of mind for the municipalities that have been doing this before is how do they change their summer programming to be more inclusive in neighborhoods maybe they didn't think about before. But secondly, I think a bigger piece to this as well, and it's always been something that's been kind of an issue, a problem that has yet to be collectively solved is what do you do with the caregivers who come and are looking for meals themselves, right? So some municipalities have fundraised for and making sure that at cost they can offer caregivers meals as well. But in these times, I don't think that that's going to be acceptable to a lot of communities. So what is the mechanism for making sure that those folks are also getting some level of food as well? Because we know from the research and anecdotally from just conversations that a lot of the children understand what's going on, what's happening, and they're offering up their meals to their caregivers, right, or portions of their meals. So it's, yes, this is an explicit population that we need to be thinking about and, you know, leveraging as best we can some of the baseline work that or funding that the federal government provides. But I do think we have an opportunity to really think and pivot to a more inclusive whole family approach in that regard.
Thank you. Would love to hear if maybe like from one person in the participant pool, how is your city thinking about students and continuing this service? If you would like to share, please raise your hand. Looks like Milsey. I'm going to unmute you, Milsey. What is your city thinking about, and can you hear us?
Hi, can everybody hear me?
Hi.
Yeah, hi.
Yes, good to hear you.
Great. Thank you so much for first of all hosting this and sharing everyone on the panel best practices. I really appreciate it. Food insecurity is a really big focus for the city of Lancaster. We are so privileged to have so many food providers here. And so the first thing that we did with the beginning, and it's similar to you, Anna, these are relationships that we've had for many years. The structure has been set up so when COVID 19 hit the city of Lancaster, as many other cities. We were in a good position on communicating with our partners and talking about where areas of gaps for all of our providers, from school lunches to our food pantries, and where could we support, and how can we leverage the contacts that City Hall has to help support some of these initiatives. So we started with our faith-based partners that really host all the food pantries. So we convened them all. Their greatest need was volunteer support and PPE, and they wanted to continue providing the services, but those were the areas that they needed the most help in. So we leveraged our partnership with United Way, and we continue to, and we also got donations of PPE for them so that they can continue their services. We also have a fund here from our local community foundation. We knew that our faith-based partners are doing such great work, but with tithing down, since they're not having their services on a weekly basis, that they were also going to need some financial support. So we leveraged some of that financial support to go towards them. We also opened up the Love Your Block grant so that they can apply for their food pantry services, to apply for funding through that. Then, so that was kind of like grassroots. Then we also looked at our school district. Our school district at the very beginning started to have conversation on stopping meal services. And of course, there was no way we were gonna let that happen. So we spoke to the superintendent and asked the superintendent what were the areas that she needed help with. And it was the same thing. It was PPE and volunteer services and training. So we leveraged our local 211, got volunteers for her, and the meal service will continue. It's been continued. So we do power packs. We also do the grab and go. And so the power packs are like more for families, where they can do meal planning, and they pick up twice a week on Thursdays and on Tuesdays and Thursdays. And we're supplying about 7,500 families in Lancaster City. That's actually going to continue through the summer. And so however we can continue to fund that and help support that, that's one of our primary goals. So our faith-based partners and our school district, their mechanism for delivering and distributing food, they've been doing it for a really long time. So we just looked at how can we continue to support the work that they're doing. We have about 32 food pantries here, and Anna, you were mentioning how can we get SNAP, our online retailers, to support taking SNAP online and delivery fees. So we're also doing a lot of advocating. We have some local grocery stores, Giant that's here, that has kiosks set up where you can go in, utilize the kiosk system, and order your food, and then it comes delivered to your home, so that you're not actually walking from the grocery store to your home with those items. So that's certainly an area that we're concerned about, and we are advocating with our local grocery chains on how they can get registered through the USDA. So that's kind of what we've been doing. And there isn't a food shortage here, so it's just distribution. The distribution mechanism seems to be like the greatest challenge right now.
Thank you, Millie, very much.
Mm-hmm.
The next question that has come up is around many of your cities. It sounds like you either have working groups or you have already existing stakeholder connections, which is really great. This question comes from San Diego, where they're exploring the same thing. What they're wondering is, how are you kind of thinking about equity and representation, as well as making sure it's a functional size of a working group or a stakeholder group you're engaging in this process? So how are you, as you're forming these groups, informal or formal, how are you thinking about representation, equity, and right sizing it so that the group is actually of help? And this can go to any panelist.
Yeah, I can talk about equity on the food policy, the DC Food Policy Council. It was something, and continues to be something, we work on a lot and focus on. So of our 13 mayoral appointed representatives on the Food Policy Council, we make sure that they represent, we have the DC is separated into 8 wards. We always make sure there's representation from all 8 wards, that we have a range of perspectives, different racial and ethnic minorities, ages, gender, background. So we have small business owners, nonprofit, more like advocacy folks. And we hope that through having a very diverse official council, that they are bringing in the perspectives of all of the networks and groups that they work with. But we also, all of our meetings are open to the public, and we also have 5 working groups, and those 5 working groups meet separately, and all of those meetings are open to the public, and are also accessible over phone. So if somebody can't make it to a meeting, they can join that way. We also have explored lots of different structures to make sure we're hearing from as many people as possible and getting feedback and suggestions for how to strengthen DC's food system. So we have, well, before the last 2 months, we were having monthly coffee chats at public libraries across the city to talk about food policy. We were having listening sessions on specific areas, because I think a lot of people, if they hear like there's going to be a meeting about food policy, that doesn't necessarily trigger for somebody like that's something I'm interested in. But if it's a meeting specifically about healthy food access in specific communities, or about urban farming, or about environmental sustainability, we realized we were getting very different people at different meetings, depending on how we marketed them. And we do a lot of online surveys on all of our work, but there's always more work to be done. I will say, not to be a broken record, but having somebody whose full-time job is to think about this on city payroll has, I think, been a real game changer. And also, I am plugged into networks. There's a U.S. Conference of Mayors has a network of all of the cities that have food policy directors. So I get ideas from them about how to incorporate, and we have equity as a constant topic of our calls, and their city's doing a lot better than DC, and I get ideas from them on how to enhance our focus on equity even more. So I'll stop there. But great question.
Thank you. Thank you. Ben, did you want to add anything in terms of how your city and your colleagues are thinking about equity representation and right-sizing these groups?
Definitely. I think that the way that you build equity, especially when we don't have this baked into any infrastructure, because there is no food policy infrastructure necessarily. Like I said, it was mostly through the Hunger Network, which was an extension of a hospital, and some faith-based organizations. I think it's just really important when you're starting your stakeholder engagement, just target those stakeholders that you think are the best representative, bodies of your population of people, and can just bake in the equity within your stakeholder engagement. So like I said about the Chelsea Collaborative or Green Roots, or if language is an issue, then, Spanish speaking organizations. So I think it's sort of how you pick your stakeholders and where you put them in your sphere, that's going to dictate how well you're addressing equity within your food network and within your food, actions.
Thank you. Yeah, Patrick.
I had to wait for that magic tone. Okay. Yeah. I think the other thing that I would strongly encourage any municipality or any staffer that's really thinking about this is think beyond the partners that you already have top of mind. Find the trusted guides in specific communities that maybe your city or municipality hasn't traditionally reached out to strongly, and just be honest in those conversations, because this again is the time where we're trying to be responsive to communities, and making sure that their voice is heard is so important.
Yeah. So there's another question that has to do with some data-oriented, it's a data-oriented question. So the question is, how are your cities tracking data on food recipients, suppliers, and distributors? And then the second question is from the same individual, how are you estimating the amount of insecurity in your city? So this is kind of like helping prep for future planning. Anybody can take it. So how are you tracking food recipients, suppliers, and distributors, and how are you estimating food insecurity, the amount of food insecurity in your city?
I'll say from Lansing standpoint, again, we're not running the system, so we don't have our eyes from the city's level, have our eyes on the data the way the distribution network is. So I can't necessarily speak to that. What I can say is, you know, we've been watching our data very carefully about the changing composition of our city. And we, like many cities across the world, are seeing on the whole or on the balance, a bit of a rebound economically. And if you're looking at just some averages without chunking up the data into groups, you're going to miss some real challenges in the community. And so, you know, our city specifically is like many, that we've seen a bit of resurgence in the urban core, and we've seen our numbers get trending better financially across the city. But when we pull that back, what we see is that we have young single folks or young couples in the city. We have older adults that are, you know, rediscovering the joys of urban life and they're in their senior years, et cetera. And what we see is that our families that are here are not doing well financially, and that data layer is covered up by some other positive indicators. And so I just say all that to say that you have to get to the next. I appreciate the question about the data, because while I can't speak to our food distribution and those types of things on that system, what I can say is that from city leadership position, making sure you're layering the data to understand where the vulnerabilities are as a whole is super important. And what we know in our city is that our families, particularly our families with young children, have not recovered from 10 years ago, and that we are not in a position that we want to be in terms of our child poverty rates and how our families are doing. And like many of the panelists have said earlier, this crisis has kind of ripped the cover off what we've known has been there all along. But hopefully we can use this as an opportunity to really shine a light on those vulnerabilities that have always been present, but now are if you've been able to ignore them before or glaze over them by other areas of success in the city, you no longer have that ability. So I think it's an opportunity to get into the data much more effectively and really be honest with how we're doing, particularly how we're doing for our children.
Go ahead, Ona.
Yeah, I was just going to add on the question about tracking food recipients and suppliers and distributors. We did a lot of analysis. We continued to look at our regional supply chain and just looking for if there's any weaknesses on particular food commodities that we know are really needed. I'll say for others, a few really helpful partners on that have been our regional FEMA office has been providing a lot of data on the Mid-Atlantic and assuring us of strength in our food supply chain currently in the region. So if anyone's not in touch with their regional FEMA office, they're a wealth of information. And then we also have like our regional council of governments. So for DC, it's called the Metropolitan Washington Council of Governments, and they have an agricultural working group that has also been extremely helpful in providing information on our regional food supply chain. So, and then we, directly called some of our larger food distributors and grocery stores and continue to be in conversation with them just to know if they're seeing any lack of product, particularly some of the essential products like infant formula. We've been tracking very closely, and it's so far been okay here. But we've actually seen like the products that have that it's just taken a really long time to get are shelf-stable proteins, so like tuna fish and peanut butter and beans. It's not that there's a shortage. I think just there's been really high demand for them, so like our food bank's having trouble getting those in quickly. And then on tracking food insecurity, you can get your monthly SNAP data from the state agency that administers SNAP. So seeing increases in demand and applications for that is really helpful. I think unemployment data is a really helpful proxy for understanding food insecurity. And then I don't want to take credit for this, but I was just talking to the Boston food policy director yesterday, and they're looking at their numbers of low-income seniors, their numbers of veterans, their numbers of trying to get a better understanding of immigrants, because particularly for undocumented immigrants, they can't take advantage of any of the expanded public benefits. So that's like I'm sure, as Ben can talk to, given your target population, just a really high risk area. So I really like what Boston's doing in creating like these subsets of food insecurity. So like Andi said, we're not missing some populations that really need help by just looking at general numbers.
Thank you. Ben, anything that you would like to add?
Sure. I think that because this is an acute response and like we didn't have the framework in place, we've been collecting some of our first data, I feel like, surrounding food insecurity. And especially, like as Anna had said, we have a lot of residents that don't take advantage of some of these other benefits like SNAP and WIC for a multitude of issues, immigration status, that type of thing. So we've been tracking most of our data through the intake system, through Airtable, downloading those, understanding that. But honestly, we just had to sort of say, we're going to serve, 40% of our population. And we're like, that's our number. And like, this is the pounds of food per person. And this is our scope for the next month. And that's how much money we need. And that's how many rice and beans and whatever. And basically how we monitor that and decide if that was an inadequate response is, our geographic pop-up locations, the lines and how many people might go unserved is a good indicator in some ways of the food insecurity. But then again, you don't know everybody that's in their home. You don't know if everybody is reaching 311. So we also had a lot of sort of engagement with healthcare professionals that were going out to any families that had anything to do with COVID-19. And those people came in anonymously into the system. So like the intake system started taking in 311 calls, and the hospital data itself, the senior citizens, the school data, like all of these multiple things. So I think that it's just important to try and understand exactly where can you get a sense for it and just get it collected all in one place and then distill it. And there might be redundancies. Like I've definitely seen that in the data for my deliveries. There's like tons of extra same families coming in, receiving it from this guy or us or this other person. So I think that what is most important, if anybody is ramping up now to do a delivery system or to do a food system, start thinking about how you're going to sort and organize your data now, just so you can sort of get ahead of it, because I'm underwater in an Excel sheet every morning getting my delivery list ready. And it's just think about your intake form, think about how you're going to process the data and how you're going to use that for your long-term solutions.
Yeah, Patrick, please.
So I think this is all great. For those that haven't already thought about it, as far as your data goes, the extra 4 after the zip becomes so much more important for targeting purposes. And for those of you that don't maybe necessarily have rather responsive state agencies for the SNAP data, think about all of the providers in your local communities that are doing that level of outreach that your cities haven't done before because they've been doing such a great job. Your councils on aging could potentially be helpful around that specific population to help you understand what's going on there. If you hear anything in the background, my daughter's starting to eat lunch. The only other thing I would say from an equity perspective and data is from a procurement standpoint, who are the vendors that you're selecting, and be very upfront and think about that, because, you know, as you're putting in all of this good work to understand what the population is and all the different levers at your disposal, we, as municipal leaders, as municipalities, the power also comes with procurement and what you're doing with those dollars, and who by default, because of where you're spending it, you're saying yes to. So from an equity standpoint, that is just an additional lens that I just wanted to call out.
Thank you. So you've received a clap for Ona and a lot of head nods. So this concludes the Q&A portion. I want to say from all of us from Cities of Service, thank you again to our amazing panelists, Ona, Ben, Andy, and Patrick. You've shared some really practical wisdom with the group, and we look forward to future collaborations. If you are working on a volunteer and engagement-based response to short and long-term needs of your vulnerable populations, and you have questions or you want to share what you're doing, please contact me, Nicola, at covid19@citiesofservice.org. With all of that, we will see you next time. Stay safe, everyone. Bye.
Thank you.
Thank you.
Bye.